Good morning, friends. Now continuing to the last part of Ntep, what will give FDC, ART for HIV, people living with TB, tenofovir 30 mg, lamivudine 30 mg, efavirenz 30 mg. 600 mg, 300, 300 and 600. So what is the second line drug? We can give tenofovir, lamivudine and a protease inhibitor like lopinavir with ritonavir. Okay, we can give zidovudine, lamivudine and any of the protease inhibitor. Rifampicin alters the metabolism of protease inhibitors including atazanavir and ritonavir and reduce their effectiveness in standard doses. Therefore, we give them in second line drugs and not first line drug treatment. TB HIV collaboration single window. So we have CBNAT, rapid molecular diagnosis, daily FDC for HIV and TB, ICT based adherence support, that is 99 dots, pharmacovigilance and isoniazid preventive therapy. So this is training that is given by combined NACO and CTD. The drugs are supplied and almost 10,000 people have been initiated on this treatment. So treatment outcome, what can it be? It can be cured. The microbiologically confirmed TB patients at the beginning of treatment who was smear or culture negative at the end of complete treatment. Treatment completed. A TB patient who has completed treatment without evidence of failure or clinical deterioration but has no record to show that the smear or culture of the specimen in the last month was negative, either because the test was not done or the result was unavailable. Treatment success, that he has been cured and is accounted for treatment success. Failure, if he is still positive by smear or culture at the end of treatment. Failure to respond. A case of pediatric TB fails to have microbiological conversion to negative state or fails to respond clinically and deteriorates after 8 months of compliant intensive phase, shall be deemed to have failed response provided alternative diagnosis or reasons for non-responsive response has to be ruled out. Loss to follow, that has stopped his treatment for one consecutive month or more. Not evaluated, whom the treatment outcome is not assigned. Okay. Then we have treatment regimen change, which was a patient who was on first line drug and then has been diagnosed with drug resistant TB and then been switched and to drug resistant TB regimen prior to being declared as failed. Died during anti-TB treatment. Then we have contact tracing. All close contact, especially household contact, should be screened for TB. In pediatric TB patients, reverse contact tracing should be done. Particular attention should be paid to the contacts with high susceptibility to TB infection. Then we have isoniazid preventive therapy that we give in HIV infected children who had been known to expose to infectious TB patient or are tuberculin skin positive more than 5 mm in duration. Otherwise it is 10 mm in duration, but 5 mm in duration means they are already immunosuppressant but have no active TB. So these are the people all children living with HIV who have successfully completed treatment for TB should receive isoniazid for additional 6 months. All TST positive children who are receiving immunosuppressive therapy like nephrotic syndrome, acute leukemia. A child born to mother who was diagnosed to have TB in pregnancy should receive prophylaxis for 6 months, provided the congenital TB has been ruled out. BCG vaccine can be given at birth even if isoniazid preventive therapy is planned. So what is the dose? Isoniazid 300 mg, pyridoxine 50 gram per day for 6 months and above a child above 12 months. This was in adults and adolescents. If child is above 12 months, then isoniazid is 10 mg per kg, pyridoxine is half, 25 mg per day for 6 months. Then we have Nikshay. Nikshay is an integrated information communication technology. It's an app that registers all of the TB patients and monitor that how have been they have been treated, what are their results, and it is a real-time case-based web-based surveillance tool that can be taken by both the person who is being infected and the healthcare worker. It is unified interface for public and private sector care providers. Okay, you can have an app, you can have it on the site. So you can have this call center, Nikshay Sampark. You can also have a mobile application and submission of hard copies to DTO. Incentives are also given. So Nikshay Poshan Yojana. So incentives are given for what? Cost of treatment, cost of travel, nutrition, if the wage is lost due to the treatment, cost of diagnosis. Okay, so nutritional support through the direct benefit transfer of 500 rupees per month for all patients. TB treatment throughout the duration of treatment. Patient needs to be registered in the Nikshay portal, and for tribal people the incentive is 750 rupees. Incentives to the provider. A private provider who notifies a person with TB is 500 INR and reports the treatment outcome is again a 500 INR. Informants incentive. The incentive to of 500 INR to the notification of patient in public center by any informant. Okay, it may be ASHA or Anganwadi worker. Incentive for treatment support. If the new case has been detected and his treatment has been completed, then 1000 rupees is given. Drug resistant case has been, the treatment is completion of the intensive, 2000 rupees is given, and at the completion of whole of the treatment of the drug resistant case, then 3000 rupees are given. Thank you. NTEP is just this much. If you have not understood anything, you can write in the comments, as I understand that I have not been able to complete all of your concepts, and I'm again sorry for uploading this video very late.